It's Wednesday, May 20. This is the news on PBCJ. I'm Carol Francis. 14 more persons have recovered from the novel coronavirus COVID-19, pushing the number of recoveries on the island to 145. At the same time, there were no new reported cases of the virus over a 48-hour period. Therefore, as at this morning, the total cases remains at 520. Prime Minister Andrew Holness has outlined strong protocols for the quarantine of the 1,044 Jamaicans who arrived at the Falmouth Pier in Trelawney aboard the Royal Caribbean's Adventure of the Seas vessel. Mr. Holness spoke in a video message to the Jamaicans on Tuesday.
It is important for your note that we have been in discussions with Royal Caribbean Cruise Line, your employers, from as far back as April 21, when we wrote exploring ways for your return. The cruise line has been very cooperative. However, cruise ships all over the world have had outbreaks and even deaths. Therefore, we have had to agree on strong protocols and make detailed preparations for your safe and convenient re-entry and to protect the public health for your families locally. The discussions with Royal Caribbean, which happened at the highest levels, were quite complicated and could not be publicly disclosed until they were finalized. Unfortunately, this created room for misinformation, mischief, and there's a lot of that going around, and your own uncertainty. Be assured, however, that without fanfare, we have always been diligently working to get you home.
According to Mr. Holness, the parish medical officer will board and declare the ship a quarantine area. He added that the measures were for legal reasons because ships operate under special laws. Those on board will disembark in phases for testing. After individual samples are taken, they will be transported to a quarantine facility, at which point the 14-day quarantine period will begin.
The parish medical officer will board and declare the ship a quarantine area. This is for legal reasons, and you know that ships operate under special laws. We will phase your disembarkation for testing. After your sample is taken, you will be transported to a quarantine facility, at which point your 14-day quarantine period will begin. It may take approximately 3 days to receive your test results, and once your test is negative, you will be allowed to complete the remainder of the 14-day quarantine period at home. If your test is positive, however, you may be required to remain in a state isolation facility until you have been cleared by the health authorities. Please use this time prior to disembarkation to update your home address details to facilitate home quarantine, as well as to complete the immigration and customs C5 forms online.
The Prime Minister also said the crew must consent to being monitored via the Jam COVID-19 app.
When you go home to complete your quarantine, please take it seriously. Not enough is known about the virus, so even if you feel fine, it is best to be careful. During your quarantine, give your mother, your father, your grandmother, or other elderly relatives a call. Tell them how much you love them, but try not to interact with them physically. Better safe than sorry. I know you have not seen your spouses, your significant others, your children, friends for a long time, and you are anxious to do so. And even though you may have tested negative, there is still a risk of infection. So please faithfully wait out the incubation period of 14 days. As part of the home quarantine protocol, you will be required to download the Jam COVID app if you have not done so already, and to keep your phone charged. This is going to be the monitoring tool that allows you to quarantine at home. You will be required to submit a video check-in periodically during the day.
1,300 people are being hired as community health aides by the government. Health and Wellness Minister Dr. Christopher Tufton says the team will strengthen the country's public health system under a new strategic framework. Gabriel Thompson has that story.
In our new normal activities, field surveillance using methods such as contact tracing, community education and health information, and the monitoring of persons in quarantine and in isolation, will be important components of the public health response.
It's the new normal, as the Health and Wellness Minister puts it, with the COVID-19 era expected to be a part of our lives for years to come. Dr. Christopher Tufton says his ministry has 3 strategic goals.
These are protecting the population from harmful health outcomes, particularly vulnerable communities, ensuring productive engagement of the individuals within the society, and creating an environment where citizens can participate in meaningful social activities that enrich their lives and the lives of all with whom they interact.
Dr. Tufton says the ministry has already begun to build out an infrastructure that will allow Jamaicans to play a role within the new normal. This approach is anchored in the international health regulation standards for public health systems and will involve the strengthening of the systems.
Mr. Speaker, ensuring that everyone counts. In implementing these plans, the ministry has already received approval from the Ministry of Finance and the Public Service for the employment of an approximate additional 1,300 community health aides. The regional health authorities have already begun the process of recruitment, and these new officers will augment the existing cadre of approximately 2,300 persons currently in the field, bringing our total complement to approximately 3,900 across the island.
Additionally, Tufton said the private sector organization of Jamaica, Jamaica Manufacturers and Exporters Association, Jamaica Hotel and Tourist Association, the Jamaica Chamber of Commerce and trade unions have all given their support. For the news on PBCJ, I'm Gabrielle Thompson.
15 people can now attend a funeral. Previously, no more than 10 persons were allowed to take part in funeral proceedings. This was one of the measures implemented by the government to control the outbreak of the novel coronavirus.
The protocol that has been established surrounding funerals, and following a meeting we had some 3 weeks ago with the undertakers, there was an agreement that funerals would be allowed. They recommended 15 funerals per day at each cemeteries, including the major ones and the public cemeteries. They recommended 15 persons in attendance. It would be 10 mourners plus the reverend and the persons who would be doing the burial.
Up to the end of 2019, there were 389 gangs operating in Jamaica. That's according to Minister of National Security, Dr. Chang. Dr. Chang was tabling the report of the Joint Select Committee of the Lower House on the Criminal Justice Suppression of Criminal Organizations Act in Parliament on Tuesday.
As of 2019, there are some 318 identifiable gangs, of which some 250 were still operational. Of the 389, I said 250 were operational. 323 of the total criminal gangs in operation are classified as first-generation gangs. The term first generation is used to describe loosely organized groups. Sometimes they're called corner groups, street corner gatherings or otherwise, which get involved in various criminal activities. These may involve simple from extortion, turf protection, drug retail, and other activities at the local level, and they operate well within the community. The remaining 66, or some 70% of the gangs, are classified as second-generation gangs. These are the gangs that exhibit more centralized leadership, focused primarily on organized crime. And they are the ones that lead criminal organizations, the networks, involving drug smuggling, gun running, extortion on a more organized scale, sometimes having their own business to which they rinse up money and get involved in transnational crime as well. There are 1 or 2 third-generation gangs which have broad reach, international access as well, and have larger numbers. In fact, they reported that maybe some of them may even have their own legitimate business through which to raise money in a very effective way. As I mentioned earlier, of second generation gangs, business operations which are recognized as legitimate operations throughout, especially operations that draw heavy cash flow.
This represents an increase of 8 gangs when compared to the 381 in 2018. And time now for the business report with Gabriel Thompson.
In Tuesday's trading session, the JSE combined index declined by 3,847 points to close at under 400,000 units. Overall market activity resulted from trading in 80 stocks, of which 36 advanced, 31 declined, and 13 traded firm. The junior market index declined by 42 points to close at under 3,000 units. Stocks advanced for 138 Student Living Jamaica, Caribbean Assurance Brokers Limited, and Caribbean Cement Company. Stocks declined for 1834 Investments, Access Financial Services Limited, and Barita Investments Limited. Trading firm were AMG Packaging and Paper Company, Berger Paints Jamaica, and Grace Kennedy Limited. Trans-Jamaican Highway Limited was the volume leader with over 8 million units, followed by Medical Disposables and Supplies with over 5 million units, and Wigton Wind Farm Limited ordinary shares with over 4 million units. Now for the foreign exchange. The US dollar on Tuesday, May 19, ended trading at $146.97. The Canadian dollar sold for an average $107.95. The pound sterling traded for $180.60, and the euro ended trading at $162.75. Oil prices firmed on Wednesday on signs of improving demand and a drawdown in U.S. crude inventories, but worries over the economic fallout from the coronavirus pandemic and weak refining margins capped gains. Brent crude futures were up 51 cents to $35.16 a barrel. West Texas Intermediate crude gained 22 cents to $32.18 a barrel. That's it for the business report on PBCJ. I'm Gabrielle Thompson.
The COVID-19 pandemic has disrupted the lives of many people. Thousands of jobs lost, financial plans, loans, mortgages, social activities have all been staggered. Many are feeling stressed, some depressed. Simone Absalom chats with CEO of the telemedicine firm Medling, Dr. Chebowen, about depression in this COVID-19 era in this week's Living Healthy report.
Dr. Chebowen says depression can be defined as a mood disorder, and it can also become a severe mental disease.
What it means is that patients usually have a low feeling of sadness, and it affects both what they do, how they do it, and how they feel. In the Jamaican experience, a lot of the causes of depression stem around relationships and finances and family matters.
Some persons who contracted the novel coronavirus have experienced discrimination, leaving them with a sense of physical and emotional isolation from family and friends. We asked Dr. Bowen to explain his impression of what COVID-19 patients and fellow Jamaicans have been facing.
Definitely, the coronavirus pandemic has been affecting people mentally on a whole, on a high level in terms of both anxiety and depression. A lot of persons are concerned about where their finances are going to end up at the end of this coronavirus. Will they be employed? People are losing jobs. Parents are being forced to, well, not forced, but they now have to manage their children on a 24/7 basis. There's no school to send them off to. Children are even stressed being at home. So everyone is under intense levels of stress. So yes, indeed, we have seen a rise in the amount of patients having anxiety and depression. And this month is actually mental health month, so it's a good time for them to, reach out and not stay quiet. It's a good time for you to get treatment and discuss how you feel.
MD Link Telemedicine Company allows a patient to connect with a doctor in real time via the internet or telephone. This means a credible psychiatrist is only a click or call away.
MD Link approach is treating depression with a team approach. We do have psychologists and psychiatrists, and your level of depression is separated into mild, moderate, and severe. For mild depression, you can have psychotherapy done. That's where you speak with a psychologist. They walk you through your thought patterns, your concerns, stresses, and hopefully they can solve all your issues and you go back to normal or you go back to baseline. With respect to moderate to severe depression, that's when you have to call on a higher team approach. So yes, the psychologists are still involved, but you want to bring on the psychiatrists and they're speaking with the patient. And if they see the need for medication, that's where they would come in and they can adjust the medication accordingly and streamline their behavioral practices.
In Jamaica, schools have been closed since March, and more than 30,000 students are using alternative means to keep up with their studies until September 2020. For the most part, exams are still on. The pressure to stay home, stay inside, keep up academically, and succeed can cause depression. We asked if students are able to access the MD Link services.
Yes and no, in that if you have a guardian or parent, yes, they can set up an appointment for you. They can set up an appointment for their child and the elderly. So yes, that can definitely happen. With depression, however, the patient still is in control of themselves, so they have to make the final decision about whether or not they want to seek medical help.
If you notice a change in your eating and sleeping habit or a lack of interest in things that give you pleasure, and those changes are increasing, then you need to seek help. You can speak to a family member, a friend, or contact MD Link, or call the Ministry of Health at 888-1-LOVE. That's 888-663-5683. Let's put an end to the silence. Speak up. Speak now.
In regional news, the St. Lucia Health Delegation has participated in the first ever virtual World Health Assembly. Fernal Neptune of NTN News reports.
Health officials were granted the opportunity to participate in the 73rd World Health Assembly and commit to the fight against COVID-19. Minister for Health and Wellness, Senator the Honorable Mary Isaac, says she is elated that the virtual session allowed for the involvement of the health team and also the contribution towards the health agenda.
This year, to see that other members of staff at the Ministry of Health are being given this opportunity to experience what it is like at the World Health Assembly makes it very, very exciting for me. I can sit here with my staff and we are having discussions as, you know, the sessions go on, as they call the different presenters. You know, for me, that is such a big learning exercise and a learning process that it makes me feel very excited to be part of it all.
Senator the Honorable Mary Isaac says the virtual session definitely afforded them the platform to report on their progress in the fight against COVID-19 and also to acquire knowledge on ways to respond to the pandemic.
We are learning a lot about what other member states did to handle the whole COVID situation, as well as what they intend to do. So we ourselves can look at best practices that they are speaking of and see how we can put it vis-a-vis what we are doing in St. Lucia, what we have done, what we did, and what we are going to continue to do in St. Lucia.
Medical Officer of Health, Dr. Glensford Joseph, says he's extremely delighted to play a significant part in this process.
Having the World Health Assembly virtually this year gives us an opportunity to join with the Minister of Health, the Chief Medical Officer, to be part of such an important forum where they're discussing several issues that are so critical to the world. From this World Health Assembly, we will be leaving with great ideas that we can take back to our place of work in our daily activities that we can implement to make this world a better place.
The 73rd World Health Assembly is attended by delegations from all WHO member states and is convened virtually from May 18th to the 19th. Reporting from the Communications Unit of the Ministry of Health and Wellness, I am Fennel Neptune.
The Alibaba Foundation of China has donated 30,000 face masks and more than 1,500 COVID-19 testing kits to Guyana. InfoHub's Lucia was at the handover and filed this report.
This is the second donation to Guyana from China towards the fight against COVID-19. Chief Medical Officer Dr. Shamli Prasad noted that this is a welcomed gesture that will impact Guyana's frontline response to the pandemic.
Test kits are vital. Of course, we know the frontline response to COVID-19 has always been to provide adequate protection for everyone who comes in contact with possible cases, and that's where the masks are so vital in providing continuous high-quality services throughout the health system.
Deputy Chief of Mission of the Chinese Embassy in Guyana, Shen Silai, explained that this is China's way of supporting the local health system.
This is a friendly gesture from Alibaba, a popular e-commerce company in China. It is a good example of Chinese companies shouldering social responsibility, and also a demonstration of Chinese caring about Guyanese. China does not only protect the life and health of the Chinese people, but also have been actively contributing to the containment and treatment of COVID-19 all over the world.
The contribution was facilitated by the Ministry of Foreign Affairs, Department of International Cooperation. This unit has been fostering international support and consultations for Guyana with an expected outcome of a more effective fight against COVID-19. For InfoHub, Lucia Haynes.
The National COVID-19 Task Force in Guyana has granted approval for 103 Guyanese abroad to return home. Shaquille Bourne of InfoHub reports.
Under controlled re-entry measures, 19 law students in Trinidad, 70 Royal Caribbean cruise ship employees, 4 citizens in St. Vincent and 10 in St. Martin have all had their requests to return to Guyana approved. According to a press release from the NCTF, these travelers are subjected to the strict requirements set by the Ministry of Public Health and other relevant ministries and agencies. Each person must also submit results of their COVID-19 tests done by polymerase chain reaction method, PCR. These results must be in English and provided 48 hours before arrival. For passengers who for any reason may be unable to do the pre-test, prior written consent would be required for quarantine if deemed necessary by the Ministry of Public Health. Further, these persons are expected to stand all costs associated with their return to Guyana. In addition, a group of 63 cruise ship employees were denied entry by sea due to associated risks. The NCTF expressed its willingness to consider an application for air transport for the workers. On March 18, Guyana's 2 main airports were ordered closed to international travel as an emergency measure to fight COVID-19. The NCTF added it will engage in further discussions related to a phased reopening of the airports. Shaquille Bourne for InfoHub.
U.S. Ambassador Joseph Mondelo has expressed concern to the Minister of National Security about the consistency of Delcy Rodriguez's visit to Port of Spain with Trinidad and Tobago's obligation as a party to the Rio Treaty.
The ambassador said while he would not normally comment on private conversations with host government officials, the government has spoken publicly about his May 6th conversation with Minister Stuart Young. He stated that Article 20 of the Rio Treaty makes it unambiguously clear that all measures imposed by the organ of consultation, like the travel restrictions on Ms. Rodriguez, are binding on all treaty parties, whether or not they voted in favor of such measures. There have been questions surrounding a meeting between Prime Minister Dr. Keith Rowley and Venezuelan Vice President Delcy Rodriguez and the context of the discussions with her. Prime Minister Rowley has maintained that discussions with the Venezuelan Vice President during her recent visit to Trinidad were based solely on the national security implications surrounding COVID-19.
In sports, a committee of industry players and other respected individuals with various degrees of expertise has been convened to look at building out the platform of the local Premier League. The governing Jamaica Football Federation, the JFF, says the committee, dubbed the Premier League of Jamaica Interim Committee, is tasked with reviewing the existing commercial, operational and governance structures and policies. The JFF says it will provide administrative support to the committee, which is committed to institutionalizing good governance, stakeholder value, and the business of sport. World Athletics President Sebastian Coe says discussions are ongoing with World 100 and 200 record holder Usain Bolt about the retired legendary sprinter helping World Athletics to promote the sport on a global level and, among other things, inspire youngsters to get involved in athletics. Lord Coe made the comments in an interview with Television Jamaica. Grenadian sprinter Brandon Taplin has lost his appeal against a 4-year ban for dodging a doping test, which means he will miss the Tokyo Olympics if it comes off next year, as well as the next 2 World Championships. A statement from the Court of Arbitration for Sports, CAS, indicated that the ban imposed by the Caribbean Regional Anti-Doping Organization last year would remain in place until September 2023. After winning the 400 meters at the Grenada Invitational Athletics Competition on April 13, 2019, Taplin left the stadium without completing doping control, despite being informed that he was to undergo a drug test. And that's our package. Join us again tomorrow, same time, same place, for more news and sports right here on PBCJ, the People's Station.